Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning and welcome to Health Talk, sponsored by Mon General Hospital. Jim Stallings not in the studio today, but filling in. Dave Wilson. Good morning, Dave.
Good morning, Kay.
Thank you for being back in here with us today.
Oh, it is my pleasure.
And we'll go right into the main segment of the Talk of the Town after Health Talk, so stay tuned for that. In the studio today, we're going to tell you something new that's happening at Mon General Hospital. We have Angie Price, and she's the new oncology nurse navigator and clinical coordinator for Mon General. Good morning.
Good morning.
Welcome to the show.
Thank you.
Also, you bring with you Pam Kisco, and Pam is a volunteer. She helped start the support group, I understand. Also retired from Mon General Hospital, and she's a cancer survivor. Good morning.
Good morning to you.
I understand, Angie, this is a new position at Mon General.
Yes, the Cancer Center opened last fall, and it has been a huge success with combining the doctor's office with Dr. Bell, Dr. Saunders, and Dr. McBee and their teams, and including the infusion center. So with a wonderful group of nurses and staff at the infusion center, and now we're able to take care of the oncology patients in one area. They don't have to go to multiple areas for their treatment, and it's just grown tremendously over the past few months. And my position came about just in talking with the director, Ellison Ponzurek, and it was a vision that she had to bring my position on board to sort of give better patient care and sort of navigate the patients throughout the system so that nothing ever falls through the cracks, and to help her coordinate and the flow of the infusion center, the flow of the clinic, to make sure we can give the patients of Morgantown the best care possible.
Feeling this vibe, and seems like every time we do a health talk anymore, there's growth, there's improvement, adding things all the time at Mon General, and these phases that they're going through, all the growth. So this is wonderful. I'm so sick of the word of cancer. It seems lately every time I turn around, there's somebody we love, the word cancer comes up. As a navigator, and you talk about in the system, from beginning towards getting them out of the hospital again, where do you navigate them to? So talk about the process.
The process, usually patients come to our physician's office once they have a diagnosis of cancer already, whether they're referred by a primary care doctor or a surgeon, and the role is to help them from the very first visit with that oncologist, just whether it's for them to go to surgery, for them to go in the hospital, or for them to start a chemotherapy treatment, just to sort of help that process move right along. And along with the wonderful staff and team that is at the Cancer Center, everybody works together to make sure we can do the best patient care and whatever we can do for the patients.
So important, I'm sure, Pam, when you hear that, because just recently my sister-in-law was diagnosed with cancer, and it's a shock. It's a shock to not only the individual, but for the entire family, because we all go through it, in a sense, as a family with our loved one. Initially, when you were told, did you feel like you were alone, or did you feel like the doctors and who you surrounded yourself really did help?
I was so lucky at the time I was working at Mon General, and my cancer was detected early, I think because of that, and I had a tremendous support system in my coworkers and my boss and my family. It's a shock when you first get that diagnosis and you feel alone for a little bit, but you've got to have support. And I'm really thrilled that we're doing this. It's such a huge need.
When you talk about support, of course, you'll have the support of your doctors and Angie and people like this, the medical world. You'll have your family, I'm sure, behind you too, and loved ones. What about feeling and working with other people that have cancer so that you feel like you're not in it alone. Other people are going the same thing as you are. So how important is that?
That is really important. Angie and I were just talking about that yesterday because we're planning for the support group. We're getting our final plan set up.
So in setting it up, and let's go to Angie about setting it up.
Yes.
Tell us how that's going to happen.
This was sort of an idea that all the physicians at the Cancer Center have wanted a support group. When I came on board, I was actually very surprised that we did not have one. As patient first as Mon General is, I was very surprised that we didn't have one. So that was one of my goals also. And then having the support of the physicians and the nurses and the entire staff, it was the right time to do this for our patients. And it was something that I wanted to do. I've been in oncology for a very long time, and these patients are special people, very special people. But to hear the medical staff tell patients, okay, this is what to expect, and this is, how we're going to treat this symptom, and even though we will tell them and try to educate them to the best of our capability, sometimes hearing it from someone who's been in their shoes.
Sharing it.
Yes, and talking to someone that's been where they're at or who's experienced what they're going through right now, and they've made it, and they're doing well. That's what I wanted to bring for our patients, is so that they can see people like Pam who have been through treatment, and she's doing great. And we sort of wanted to give the patients hope and bring them together so that they can talk to somebody that's been in their shoes instead of just us who, are trying to help them the best we can.
Pam, how much did it help your spirits when you were able to talk to another patient and they were able to say, oh, well, that wasn't so bad, or, well, when this happened to me, I did this to get through it. Did it help lift your spirits through the process? Amazingly,
because I'm a 2-time cancer survivor. I've had breast cancer and ovarian cancer. So out of the blue, every single day, someone changed my life by just showing me how much they cared for me, and especially people who were going through the same thing I went through. People in treatment. It was just wonderful, just wonderful. I had coworkers making caps for me so I didn't have to be bald at work, things like that. Support is everything.
And when you're talking with people going through the same thing, loved ones will say, oh, well, I know what you're going through. It's tough. And you think in the back of your mind, well, that's nice. They care, but they don't have a clue. These people have a clue, don't they?
They don't. Unless you've been there, you can love the person in your family who has it, and your friends can care for you as much as anything in the world, but only people going through it or who have been through it really know exactly what it's like. And when you see somebody who's been through it once or twice and who, like me, is lucky enough to still be here and loving life and enjoying life to the max, that gives other people hope.
304-296-0041 if you want to join in on the conversation this morning. If you have any questions about the support group forming and you would like to know more about it, this is your opportunity. You talked about the Cancer Center opened last fall, and what accomplishments have there been since the opening of this center?
Oh, tremendous. I mean, multiple things that I can't even list, that there are so many. Our numbers have increased, but the one thing that has not diminished or that continues to get better is the quality of patient care. And whether it's from the patients walking into the doctor's office or walking into the infusion center, the patients are truly felt like you're walking into a family.
I was going to ask you about the comfort side of it and coming in and having to spend a lot of time there. So talk about the comfort of all of it.
Well, I've even heard it from multiple patients who I've spent time with that they've been to different facilities all over the country, but when they walk in to our cancer center at Mon General, they feel like they're home. They feel safe. They feel like that the people taking care of them truly care what is going on with them, how they're feeling, what's going on in their life, and that's true even from when we have meetings with people from other places in the community that come in, they even get that feeling. And so for our patients to tell me that, and they've been to, larger centers across the country, and they said, you know what, this is where I want to be. This is where I feel like I'm at home, being taken care of by people that truly care about me.
A lot of people in this area do go to Mon General. What about out of state? Do you find people coming in from other areas into Mon General?
Actually, we do. We have a lot of people coming in from Pennsylvania. I myself am originally from Pennsylvania, and actually a lot of our nurses in our infusion area and the doctor's office are all originally from Pennsylvania too. So we have a lot of patients that come from Maryland, from Pennsylvania, even some from Ohio. And now with the services Dr. McBee's able to offer, we have people driving, hours to come to obtain his services. So it's been tremendous.
Pam, you didn't have this support group at Mon General at the time. And of course, as a cancer survivor, I guess in going through that, did you feel like something was missing or you needed more help in some way?
Yes, and actually, my sister and a nurse at Mon General tried to start a support group, and for a while we had one going because I did feel like I think your best chance to survive is to be treated as completely as a whole patient, and the support is needed so bad just because you're not alone. Other people are going through the same thing you are, and that's just a gift you need to give.
And right now, I'm sure a lot of people listening to this show going through cancer treatments, going through this, and we all know you're going to be a survivor. You're going to be very positive, and the family and all of you are going to work hard. But this is another step, the support group. Again, if you have any comments or any questions, 304-296-0041. We'll take a break and be right back.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
I'm sure anyone going through cancer treatments right now, really talking about it can be very emotional. We'll try to do some of that talking for you this morning. We're talking about a new support group being formed by Mon General Hospital, and Angie Price is with us, and also Pam Kisko. Pam is a cancer survivor, and she knows the importance of having these support groups. And Dave, it's something new at Mon General, but I think it's something that's really going to take hold. I
think so. And my question to you, Pam, you say you're a two-time cancer survivor. Was there ever a time, when you went, man, this is the second time especially, can I go through this again? And other cancer survivors who may have gone through it more than once came to you and said, look, you can do this. We've done it before.
Yes. Actually, when I found out that I had ovarian cancer, this was a few years after the breast cancer, I had said before that to my sister, who was my basic support, that I would never go through chemo again. I would never go through radiation again. I just wouldn't do it again. And the day after I found out I had ovarian cancer, I said, where can I sign up? Because your will to live really comes into it. But you absolutely need the support. You need the support. You need to know you're not the only one out there. Because there are a lot of things that you just can't. You want to protect your family. Sometimes I think it's harder on the family than it is on the patient. But to another cancer patient, you can say what you're thinking, what you're really feeling, because they're feeling the same things. And a little thing that they might tell you can really help you.
And Angie, we've been talking about this support group. So when are you getting to get this support group together? Where are you going to meet? What's all the specifics?
We are actually planning to start this the first Tuesday of every month. Our first meeting is going to be Tuesday, August 7th at 6:30 p.m. in the Zelda Stein Weiss Cancer Center. We're actually going to meet in the lobby of the Infusion Center, so it's very easy to access. You actually come in the East Canopy entrance at Mon General Hospital. You take the elevator as soon as you enter the East Canopy to the third floor, And when you get off the third floor, you enter the Zelda Stein Weiss Cancer Center. And the infusion center is to the right, and the lobby's right there. And
We will be there.
And you will see Pam and I there waiting. And we hope to have as many people come that can come. This is open to cancer patients, whether they're currently going through treatment, they were just diagnosed, or they're a cancer survivor and just want to talk about how trying to get back to their normal life, or even caregivers. So if it's a wife that's going through breast cancer and her husband's the primary support, we want them both to come. If you have a sister like Pam did, who was her primary support system, we want those people to come. So it's open to anyone. And we hope, even we've already talked and we said we're not going to get discouraged if we don't have a huge turnout the first time. We're still going to do it again the following month, because this is something that us as a group at the Cancer Center want to provide for our patients. And Pam and I both feel that if one person shows up Tuesday, August 7th, then that's one person that we can help and we can in touch and make a difference too. So
we're committed.
When you have the meetings, you're going to have speakers come in, or are you just going to sit down in a circle and just sit and talk?
We will eventually have speakers. We want to find out what our patients who come to the support group want, and what they would like. They're going to have a say in their own support group.
Good.
And it'll be getting to know each other and talking about what's on their minds and what we can offer them.
They'll be able to ask questions.
Oh, absolutely.
yes.
Because I think that interaction is really going to help, and how they get through a day. Some days it's tough, because I can see it with my family member. It's tough getting through some days. So I'm sure they have lots of questions, and relating to someone else like you, Pam, it's bound to be a help.
Yeah, interaction is what it's all about.
304-296-0041. We'll take our last break. Be right back.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
A new support group for cancer patients started at Mon General Hospital, and we're going to wrap this up with the last minute information about the support group. And if you know a loved one, if you have a friend that's going through cancer and you're finding that they're depressed, or maybe they need a little boost of some sort, because I'm sure, Pam, you go through many stages.
Absolutely.
Even while you're going through the chemo, things are looking good, the numbers look better, and you're getting positive results. There's still a side where I'm sure you're just depressed as this has all happened to you.
Absolutely. And even as a survivor, it's still with you. It's always going to be with you. And you need the support all along.
You hit on something there, because just recently my sister-in-law said, your life will never be the same.
Right.
Because that will always follow you. Even though you're going to improve, you're going to be a survivor. It's still always there, I'm sure.
In a lot of ways, your life is better because you find out who truly loves you and how much you want to live.
I'm glad you
But
said
it's
that.
never the same.
And that's why this support group is going to be so important, Angie. So let's run down a contact number. And you had described exactly where this is going to be located, on the third floor of Mon General Hospital, right there in the lobby. Easy to find, plenty of parking.
Yes.
No problem there. It's on a first Tuesday of every month.
Yes.
And who should they call?
If you have any questions, you can call me. My number is 304-285-3808, and I would be happy to answer any questions that you have about the group. Again, it's Tuesday, August 7th at 6:30 in the Zelda Stein Weiss Cancer Center. And actually, Pam and I will be serving some light refreshments also. So,
Another reason to go.
yes.
Absolutely.
And you can bring a family or a loved one, friend with you, which would be like a support for the support group.
Yes.
Absolutely.
Open to do that. All right. Thank you both for being with us.
Thank
Good
you so
stuff.
much.
Good stuff.
Thank you.